Hello, pet lovers, and welcome to the Botanical Biohacking Podcast. With these podcast episodes, I tend to prepare content and sometimes arrange interviews. But what I've noticed is that I usually get incredible conversations right after the interview is over, or from friends and colleagues in more natural settings. It just doesn't flow the same way as when people know that they're on the spot. So I picked up a portable microphone recorder before the Jinjiao seminar in San Diego. Now, Jinjiao is my teacher in Chengdu. He specializes in fighting hidden yin excess, particularly hidden dampness. These are the latent bacteria, fungi, and other little nasties that set up biofilms and engage in molecular mimicry to throw off diagnosis. So people don't tend to see Jinjiao for the easy stuff, they see him for the hard stuff, and that's because he's looking at things not just as what's in front of him, but looking for what may not be obvious. So his seminar was pulling in some of the most capable people in Chinese medicine in the West, and I wanted to be there to capture the conversations because I knew people would just have outstanding conversations. Whenever I hear people talking at this caliber, I'm just always kicking myself thinking, oh my God, I wish this was a podcast episode. So the two gentlemen in this podcast episode are absolute miracle workers. Clayton Shiu has a successful neurological rehabilitation center in Manhattan. He trained with literally the most respected acupuncturist in China for stroke recovery. He's a kung fu master and does incredible work, which I've been fortunate enough to experience for myself. He does seminars around the US, and even if you go to one seminar, even if you watch the needling technique of one of his students who went to one of his seminars, your skills will skyrocket. And I can't say that about myself. I can't say that about most people. But his needle technique is that extraordinary. And his level of detail in the way that he explains it is also extraordinary. So whether you want to really follow and be his disciple or just check it out once, it would be the kind of seminar that you wouldn't regret. Also, I've got to tip my hand here and share a little Clayton Shiu secret. When he has his seminars, he usually has a first day or some time that he sets aside for Tai Chi. And people may think, oh, well, I learned Tai Chi. First of all, he studied from an incredible Wu-style Tai Chi master, among others. And his Tai Chi class is actually a Chinese medicine class. The way he explains Qi flow, the way it's cycling through the body, is an essential part of the needling practice. So if you're going to a Clayton Shiu seminar and he has some optional Tai Chi class that you can go to if you fly in a day early, do it. Because that's also where he's weeding out people who are going to be serious students from people who are just trying to, get a little something. So either way, if you're just trying to figure out a little bit of needling technique, go to the Tai Chi class. You won't regret it. Fabrice Piche is a high-level martial artist who studied Salat and spent years diligently studying medical Qigong. Now, most Qigong people I kind of avoid because they're weirdos. Fabrice is the real deal. His teacher is also one of the most well-respected and studied Qigong practitioners in China. He attended Chinese medicine school in Canada and now works at a state-of-the-art stem cell clinic in Los Cabos, Mexico. He works with clients who suffer from mold and Lyme disease. The system he does is called the 18 methods, or 18. The combination of botanical biohacking herbs using Jinjiao's treatment protocols, Clayton Shiu's nanopuncture, and Fabrice Piche's 18 Qigong seems to be a winning combination. And I felt elated to see these methods spread through the US, Canada, and Mexico. Although they seem to come from very different lineages, they actually share something in common, and that's the idea of clearing out the yin excess before nourishing. And this comes as somewhat stark contrast between most Qigong that you see out there is just nourishing, most herbal medicine out there is basically just nourishing, and most acupuncture is also nourishing. And this is because it was created and designed for people who live a very different lifestyle. So the people at the top in China who are at the top of their fields take a very different base assumption. And in doing this, you can get some rather predictable miracles. So this conversation started at a shared Airbnb. I heard them speaking about a patient they'd been working on, and I asked them if they could repeat, just hold up there, start from the beginning, let me grab the recorder. There are kids playing in the background, so I appreciate your patience with that, but this conversation just couldn't be missed, and it highlights the difference between what is commonly practiced in the West and what Clayton, Fabrice, and I learned from the highest tier practitioners in China. The essential concept is that we remove what is blocking rather than trying to nourish prematurely. Of course, nourishing is important, but you want to wash the dishes before you add more food to them.
Hello, this is Dr. Clayton Shiu,
and Fabrice Piche,
our Qigong master, and we're here to talk about an interesting case where you can get these false positive signs of yin deficiency and also blood deficiency patterns. And what we're going to do is explain how you can figure out to use techniques where you can break yin excess and blood stasis that's buried in the yin meridians to actually have an effect where these yin deficiency and blood deficiency symptoms appear to be retonified and restored. So Fabrice is going to introduce this interesting special case, so I'll leave it to Fabrice.
Thank you, Clayton. So the patient we are talking about is actually a patient we worked on together at the clinic I work at in Los Cabos, Mexico. It's a specialized clinic in stem cell in which I'm managing the Chinese medicine department. Clayton came over for a visit and agreed to work with me on that particular case. It's a young woman, early mid-20s, that was originally diagnosed with rheumatoid arthritis. Things just started to get worse and worse. She started to not be able to move. Her articulation, mostly elbows, wrist, shoulders a little bit, then hips and legs became a bit more difficult for her to move. And what was actually discovered later on is that it was linked to Lyme disease and not actually rheumatoid arthritis. And so this young person in her early 20s started to see very quickly her health decline. She has very few muscle left, very skinny. Digestion doesn't work too well either. And so she's coming to the clinic to get some support with that.
Mm-hmm. Yeah, and in many cases of Lyme disease, when it's so severe, the person starts to look very emaciated, very thinned out. And in many cases, people only prescribe antibiotics like doxycycline and also other medications that will also further drain and attack the person. So it causes more vicious cycle where the person actually looks even more emaciated, more drained out. And even when we took the tongue and pulse, there were definitely like deficiency, blood deficiency patterns and signs. So with the method we used, we applied the Shinao Kai Chao, awaken the spirit, opening the orifice methods. And so what we did was we tried to move her arm, right? But her arm has in a sense shriveled up so much that you could not like make her arm straight at all. It was locked in like almost like a 90-degree angle. And if you tried to pull or straighten the arm, it was almost like the tendon would rip off the joint and the bones are just rubbing against each other, right? So. Mm-hmm. So they asked, Fabrice and the other doctor asked me to help out, and it was my pleasure to take a look at her and see what was going on. And in this case, we actually used a lot of palpation first, right? So we palpated along the heart meridian, and if you palpate deep enough, we actually could feel in a deep level in the arm, like some buried blood stasis, yin excess build up all the way through to the elbow, pulls in the elbow, then gets all the way out to the hand. So we started just doing more like medical qigong, because I practice it as well, and just trying to warm up and break down the meridian and try to free the heart meridian. Okay, because now it's not only in excess, but it's also because of the heat. It's cooked, and almost like that stasis is evaporated deeper into the body. So as we started to do that, the arms started to straighten. Okay, and I think like the surgeons didn't think it was possible, correct, Fabrice?
Yes, so one of the doctors she had spoken to before she started to come to our clinic was suggesting that the way her articulation, particularly the elbow and wrist, were so jammed that they would probably need to just grab a hammer to break it and operate afterwards to try to allow her to move somewhat. Fortunately, that didn't need to happen.
Right.
Through the work that Clayton was doing while he was there, mixing up the massage and the acupuncture, we could see very quickly that the range of motion from the elbow really started to improve. And what was very interesting is that it also remained the way it was afterwards. Her elbow was bent more than 90 degrees. So, even just driving was becoming super difficult. And so after that, she was able to drive, to go back to the beach, she was starting to feel also a lot more energy globally, mixed also with the rest of the treatment at the clinic, but starting to feel that she could do more. And recently she was mentioning to me that sometimes she felt a little bit tired and she was like feeling a little sad, and then realized, no, but I'm tired because I did things. My body aches a little bit because I'm out driving, I'm walking, I can move a lot more. So it's a good thing. It's a good pain, actually, that's very different than the very severe pain she was feeling before through being affected by the Lyme disease and the different symptoms that she had.
Yeah, and that's a great point, is soreness isn't always a bad thing. It's like some soreness makes you aware that you're alive, that you can sense things, that you have circulation, and a lot of times as we get restored, it's just like when you get back into the gym or a workout, you're going to be really sore those first couple days, right? But then your body readjusts itself, and usually if we can get the right transformation to happen at an area, whether it's the arm or your lower back or the ankle, and we get the mechanism switched back on and the healing starts, it doesn't usually switch back. So if it does, in my experience, it usually means you only hit part of the problem, but you didn't hit the root of the problem. So I think her arm stayed warm or warmer after we did that. And then the great thing is that actually Fabrice was able to continue the treatment and also apply medical qigong to further help her progress, right? So.
Yeah, what was very interesting is that after all the tension from the muscle were very well released, the week after when I started for follow-up treatment, it was actually now the bones that were limiting her movement. And in that case, what happened is that the wrist was so tense and blocked, it felt like there was just one bone instead of many bones that should move all together, and actually prevented the two arms, the two bones in the forearms to adjust so that the elbow could open more. So what I ended up doing is actually working very gently to unstuck all the little pegaso. I just have the word in Spanish coming up. All the little place where the bone were stuck together, and gently kind of breaking that and moving very slowly so that the synovial fluid could come back, so that the space between the bones starts to go and that the movement can come softly.
The adhesions.
The adhesions, there you go. Thank you.
Yeah. And adhesions are also like, they're in a sense phlegm accumulations. Phlegm is also can be categorized as yin excess, right? So if we heat up phlegm, if we drain phlegm, if we break up phlegm, and the body then processes it, usually the body can restore itself. So definitely the joints get it. even in the fingers, look, if you're dealing with anyone who has arthritis, there's a good percentage of that swollen joint that's not bone. It's actually just trapped synovial adhesion tissue. And if you can improve it and break it apart, right, and whether you're using Qigong, Moxa, heat therapy, you can get phenomenal results for the person and restore a lot of function. So this is our example of something appearing to be extremely, extremely yin deficient, but actually it's the root cause is a yin excess that's buried deep in the body. And it's a matter of how you palpate and search and try to figure out how to reach that buried aspect. And if you can, magically enough, the body looks retonified and restored, and the person looks less yin deficient.
Mm-hmm.
Right?
Just like a dam blocking a river, if you're able to open it up, then the flow start to go and all the life can start to grow again.
Yeah, great. Thanks for having us.
Thank you very much. Have a beautiful day.
You too, beautiful people.